Alright, we're going to do the cranial nerve assessment. Cranial nerve 1 is olfactory. So I'm going to have you close your eyes.
Okay.
I want you to cover up one of your nostrils. And I'm going to ask you to smell this and tell me what it is. Sniff.
Cinnamon.
Okay, keep your eyes closed. And cover up the other nostril. And take a sniff and tell me what that is.
Garlic.
Perfect. Cranial nerve 1 is intact. Cranial nerve, you can open your eyes now. Cranial nerve 2 is optic. So I'm going to place my fingers over here to the side. And then I want you to just look straight ahead and tell me when you see my fingers, okay?
Yep. Yep. Yep.
Okay. Cranial nerve 2 is intact. Then we have cranial nerve 3, 4, and 6. That is olfactory, trochlear, and abducens. So we are going to test your eyes. So I want you to look at the end of my finger and just follow my finger with your eyes. Keep looking at my finger. There's no nystagmus. And then we're gonna cover your eye with this sheet of paper. And there's no abnormal movement of the eyes. All right, cranial nerve 5 is trigeminal. And that wants you to clench your teeth. And I'm gonna just feel your temporal and masseter muscles, and that is intact. And then we're going to test soft touch, and then dull and sharp pain. So this is what soft touch feels like. So I just want you to tell me when you can feel it.
Yep. 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 Yep.
Okay. And then this is soft or dull and sharp. So close your eyes and you'll tell me which one you feel.
Yep.
Which one, dull or sharp?
Dull.
Okay.
Sharp. Sharp. Dull. Dull.
Good. Okay. Next is cranial nerve 7. That's the facial nerve. So we're going to do some facial expressions. Smile, frown, and surprised. Okay, that is intact. Next is auditory. I've got my tuning fork here. I'm going to place this on the top of your head, and then you tell me when you can't hear it anymore.
Okay. Can't hear it.
Okay. That is the Weber test, and you passed that. And next is the Rene. And I'm going to hit this and then place it on your mastoid, and you'll tell me when you can't hear it.
Can't hear it.
Okay, and
Can't hear it.
okay. So air conduction was twice as long as bone conduction. Next is the cranial nerves 9 and 10, which is the glossopharyngeal and vagus. So we are going to get this tongue blade here. I'm gonna grab my pen light. Oops. I want you to open your mouth and tilt your head back just a little bit and say ah. Okay, the uvula moved upward, which is normal. And then next, I'm gonna have you swallow. Okay, swallow's intact. And then we're gonna test your gag reflex. This might be a little bit uncomfortable. Perfect. Okay. Next is cranial nerve 11, which is the spinal accessory nerve. I'm gonna place my hands on your shoulders. I want you to shrug them up. Okay, and then turn your head against my hand this way, and then turn the other way. Perfect, that's intact. And last we have the cranial nerve 12, which is hypoglossal, which is tongue movement. Have you open your mouth and stick your tongue out. And the tongue is symmetric, move it from side to side. Then movement is intact. And then I want you to stick the tongue on the inside of your cheek and move it towards my hand. And then on this side. And cranial nerve 12 is intact.